So, what does it feel like when you first speak to patients?
So when you first speak to patients beforehand, it's quite nerve-wracking. But if you're good at sort of just chatting away to people, if you've got a good sense of humour, if you've just got that general chit-chat about you, it's really easy once you do it. It's not really scary, you just kind of do it in the moment, and it's as if you're chatting to, anyone in the supermarket or like anywhere really. It's just the same as that, regardless of what age they are, their culture, their religion, anything. You just kind of chat away to them as if, they're your neighbour.
It's very scary. It is. Even if you're quite a kind of social person, the environment's quite off-putting, and it does, you do get a lot of anxiety with it. And even myself, I've got quite a lot of clinical experience, but if I've not spoken to patients for a while, I'm still a bit nervous before I go in there. It never really stops being a bit weird and a bit anxiety inducing, but you get a lot better at dealing with the anxiety and sort of knowing how to manage that stress, and it does get easier over time.
At first I found it nerve-wracking because I wasn't too sure what questions I wanted to ask. However, as you progress throughout medical school, it does get easier.
First of all, it was very surreal. I think you kind of have an idea when you're a patient, when you go to see a doctor, what it's like, but when it's kind of reversed, it's like a completely different scenario. It was very rewarding, but again, it was also very challenging. When someone comes to see you, they have these expectations of what a doctor is, and being a medical student, obviously you're not there yet, but it's a very rewarding experience, and it really humbles you, being in a position where you can advise people.
Despite the fact we all know how to talk to people, speaking to patients for the first time can be really daunting. That's why I'm a big fan of the way Glasgow use simulated patients with volunteers from the community, and you do role plays of patient scenarios and interactions. It gives you somewhere that you can completely trip over your words, forget your train of thought and questions, and make a complete mess of it without any harm to come from it. It gives you somewhere to get that confidence and learn how to take a history, for example, in a completely safe and relaxed environment, get feedback, grow and develop, and then I'm hoping that when I get a bit further than first year, when I meet real patients for the first time, it'll be that little bit less daunting.
In first year, we got a lot of practice speaking to simulated patients and taking history from each other as well. So when I first spoke to patients, it was a little bit daunting because I was like, oh, this is the real thing. These are real patients. These aren't actors. But I think the preparation that we'd had beforehand really helped. And actually, the patients were really, really lovely. And it was really nice to speak to people who'd actually been and experienced all of the things we'd been learning about.
When I first spoke to patients, it was really, it kind of set me on the edge because I was so afraid of annoying them and them thinking that, speaking to me was completely useless because I wasn't necessarily adding to their care in any way, shape or form. I was just learning about the condition for my own learning. But I realized from speaking to more and more of them that they were really understanding. They understood, they kind of appreciated why you needed to speak to them. For your, and a common phrase you'd hear is, if you don't learn now, when will you? So yeah, over time I got to be more comfortable in my own skin.
It's quite intimidating. You're not really sure what's appropriate or obviously not sure what they're going to be like when you meet them. But it was actually very okay. Generally doctors will choose patients who are good at talking to students to speak to you, and the one I had was willing to have a sort of very friendly chat.
Speaking to patients at first was quite daunting because I felt like I needed to know everything in terms of speaking to them to get a history of it. I felt like I had to do almost the job as a doctor. But really in your first few years, it's just about speaking to the patients and getting an appreciation for how their condition actually affects them on a day-to-day basis.
There's no getting around it, unfortunately, but the first time that you speak to patients by yourself can be extremely nerve-wracking. However, if you go to Glasgow, you spend a lot of first and second year learning with simulated patients who are actors and they can typically be quite harsh on you. That's a good thing because when you get out onto the wards it can make it feel a lot easier. The first time that I spoke to a patient by myself, I actually found it a really enjoyable experience because patients quite often do want to help out students.